So I do general cardiology and interventional cardiology. Interventional cardiology is basically looking inside the heart to see if people have blockages and then deciding how to fix those blockages with balloon, stent, or other therapies that we have. I don't know, it seemed like the most interesting thing for me when I was in medical school and residency. It was the right combination of interacting with people and doing procedures and spending time with people in the hospital and in the office. You know, I do a lot of work in the cath lab, and a lot of things have changed since I started 16, 17 years ago. We're doing a lot more radial cases, which are more comfortable for patients. In other words, we're using the wrist artery rather than the leg artery to access their heart, to look at their arteries in their heart and put stents in or do procedures there. It's a lot more comfortable for patients. It's also a little bit safer than it used to be. And the other big advance is the imaging technology has gotten a lot better, where we're able to actually put infrared cameras inside the heart and have a very clear picture of what blockages actually look like. You know, I think the main thing I like to tell people is that no matter where they are, whether they're healthy or they have a lot of health problems, there's always some room for improvement. There's no one that is without hope. There's always something that we can do that's maybe not being done or hasn't been considered. And I try to let my patients know that, you know, there are options if they're willing to do them, that we can perform to get them in a better situation. Well, just recently I did a very complex intervention on a patient who had a left main artery blockage, and it's something that you generally wouldn't tackle unless the patient was having a lot of problems. It already had bypass surgery, and we had to do different types of techniques that are a little bit harder to do than just the run-of-the-mill heart catheterization. But the patient was having a lot of symptoms of chest pain and heart problems, and so it was a long procedure. It took a couple of hours, but we were able to get through using a special type of drill called a rotablator and get a really fantastic result, and hopefully help the patient down the road feel better and have a good, healthy life going forward. You know, I enjoy talking to patients and seeing how they're doing. I really think that one of the reasons I went to cardiology is because, unlike some of the other specialties, you really feel like you can impact the patient and take them from a very bad situation where they're either having a heart attack or, you know, are very ill, to getting them back to health and seeing them again in the office. There's a new challenge every day. Different types of patients have different types of problems. Sometimes it's just reassurance, telling patients that they are okay. But you know, it's a different adventure every day.